Mr. Speaker, with permission, I'd like to make a statement on coronavirus. This deadly virus continues to advance across the world. The World Health Organization has confirmed that the number of new cases in Europe is now higher than during the peak in March. Here, the latest ONS figures indicate 6,000 new infections a day, almost double the previous week. As the Chief Medical Officer and the Chief Scientific Advisor said earlier today, we're seeing a rise in cases across all age groups. This pattern is emerging across the entirety of our United Kingdom. And earlier this afternoon, the Prime Minister held discussions with the First Ministers of the devolved administrations and the Deputy First Minister of Northern Ireland to make sure that wherever possible, we are united in our efforts to drive this virus down. We know that the epidemic is currently doubling around every 7 days, and that if we continue on this trajectory, we could see 50,000 cases a day by mid-October. So there can be no doubt that this virus is accelerating, and we must all play our part in stopping the spread. Mr. Speaker, I'd like to update the House on decisions the government has taken so far. The first line of defence is, of course, the social distancing that every single one of us has the responsibility to follow. This includes the basics, hands, face and space, and the rule of 6. And a crucial part of this is people self-isolating if they're at risk of passing on the virus. People who've tested positive and their close contacts must self-isolate. This is the primary way that we together break the chains of transmission. Now, I know that self-isolation can be tough for many people, especially if you're not in a position to work from home. And I don't want anyone having to worry about their finances while they're doing the right thing. So we will introduce a new £500 isolation support payment for people on low incomes who can't work because they've tested positive or are asked to self-isolate by NHS Test and Trace. It will start next Monday. It will apply directly in England, and the UK government will be providing funding through the Barnett formula to the devolved administrations so that similar support can be offered to people in Scotland, Wales, and Northern Ireland. Mr. Speaker, just as we're strengthening our support for those who self-isolate, we propose to strengthen the sanctions for those who do not. The vast majority of people who are asked to self-isolate do. But these rules are so important that we must ensure that nobody breaks them. We're therefore proposing a new legal duty to self-isolate, again, for people who test positive or who are asked to do so by NHS Test and Trace. This is backed by fines of up to £10,000 for repeat offences and serious breaches. We'll step up enforcement too. NHS Test and Trace will make regular checks on those who are self-isolating, and we'll crack down on employers who try to prevent staff from following the rules. Over the past few months, self-isolation has been instrumental in breaking the chain and blunting the force of this virus. We know that it works, and with winter ahead, we will support everyone to do what is right to help stop the spread of the virus. The next line of defence is testing and contact tracing. We're doing more testing per head than almost any other major nation. Our daily testing capacity is now at a record high, 253,521, and it continues to grow. And on Thursday, we announced that 2 new lighthouse labs will be set up in Newcastle and Bracknell, increasing capacity further. But as the House knows, alongside this record expansion, demand has gone up too. And so we need to prioritise the tests for those who need them most, to save lives, protect the most vulnerable, and make sure our health and care services and our schools can operate safely. Today, we've published our list of where tests are being prioritised, setting out how we will make sure tests are allocated where they're needed most. First, to support acute clinical care. Second, to support and protect people in care homes. Third, NHS staff, including GPs and pharmacists. Fourth, targeted testing for outbreak management and surveillance studies. Fifth, testing for teaching staff with symptoms so we can keep schools and classes open. And then the general public when they have symptoms, prioritising those in areas of high incidence. And I want to reinforce this important point. The system relies on people coming forward for tests if and only if they have symptoms of coronavirus or have been specifically advised to by a health professional. The testing capacity we have is valuable, and we must, together, prioritise it for the people who need it the most. The next part of our defence is local action. We've been vigilant in monitoring the data and putting in place targeted local measures, so we can come down hard on the virus wherever we see it emerging. In the summer, when the virus was in retreat, we were able to relax some of the measures that we'd put in place. But now, as the virus is spreading once more, we have had to act. On Thursday, I updated the House on the changes we're making in parts of the Northeast, and on Friday, we introduced new rules for parts of the Northwest, West Yorkshire, and the Midlands. We've seen some concerning rates of infection in these areas. Liverpool, for instance, Mr. Speaker, now has over 120 cases per 100,000 population, and in Warrington, it's about 100. As a result, working with local councils, we're putting in place stronger restrictions to protect local people. In parts of Lancashire, Merseyside, in Warrington and Halton, we're putting in place new measures from tomorrow. As with our strategy overall, our goal is to protect education and employment as much as possible while bearing down on the virus. Residents should not socialise with people outside their own households or support bubble. Hospitality will be restricted to table service only, and operating hours will be restricted, so venues must close between 10 and 5. From tomorrow, in Wolverhampton, Oadby and Wigston, and the whole of Bradford, Kirklees and Calderdale, people should not socialise outside their household or support bubble. We know from experience that local action can work when local communities come together to follow the rules, tackle the virus, and keep themselves safe. And I know how hard this is. We're constantly looking for how we can ensure measures bear down on the virus as much as possible while protecting both lives and livelihoods. And I've heard the concerns about the impact of local action on childcare arrangements. For many, informal childcare arrangements are a lifeline without which they couldn't do their jobs. So today I'm able to announce a new exemption for looking after children under the age of 14 or vulnerable adults where that is necessary for caring purposes. This covers both formal and informal arrangements. It does not allow for playdates or parties, but it does mean that a consistent childcare relationship that is vital for somebody to get to work is allowed. I'd like to thank colleagues from across the House, including the Right Honourable Member for Berwick-upon-Tweed and the Honourable Members for Sunderland Central and North West Durham, for working with us on this important issue. And I hope this change will provide clarity and comfort to many people who are living with these local restrictions. It shows the benefit of cross-party working across the House and listening to concerns as we all do our best to tackle this dreadful disease together. Mr. Speaker, the virus is spreading. We're at a tipping point. I've set out today the measures the government is taking so far. We're working right now on what further measures may be necessary, and the Prime Minister will update the House tomorrow with any more action that we need to take. This is a moment where we once again must come together to tackle this deadly disease, and I commend this statement to the House.
I now call Shadow Secretary of State Jonathan Ashworth.
Speaker, and I welcome advance sight of the Secretary of State's statement, and we particularly welcome the action that he's taken on childcare. There can be no doubt that the presentations that we saw today from the Chief Medical Officer and the Chief Scientific Advisor were stark and deeply concerning. The Secretary of State yesterday described this, and he repeated it today, as a tipping point. I agree we are at a perilous moment. The exponential growth in the virus cannot be ignored. This virus takes lives and it leaves many with long-term debilitating conditions. Every reasonable action must be taken to save lives, minimise harm and keep our children in school. That means a suppression strategy to drive infections down. So will he reject those siren voices who are telling him that the virus has lost potency, or that we should let it rip through the herd while the vulnerable shield? We support the local restrictions that he has had to impose, including in Chorley Mr. Speaker, and we understand why he's made that decision. Neither he nor I came into politics to place upon individuals a heavy burden of curtailment on our freedoms. And while I, as the official opposition, would always welcome greater parliamentary scrutiny of these restrictions, we will continue to work constructively on a cross-party basis where restrictions are necessary to arrest the spread of this virus. But can I also say to him, ever so politely, of course, that the tone of his remarks yesterday rather gave the impression he was blaming people for breaking the rules and allowing the virus to grow. But the reality is that people have done everything they were asked to do. They've missed birthday celebrations, missed weddings, missed funerals. They've sent their children back to school, quite rightly. They've gone back to work. They've done what they were asked to do. In return, ministers were supposed to fix, test, trace and isolate so we could, in the words of his own government advert, get back to the things we love. Now, before the summer, the government commissioned the Academy of Medical Scientists a scenario plan. They modelled that the R value could rise to 1.7 in September. That's what Imperial are currently estimated to be. And they recommended significantly expanding the capacity of test, trace and isolate programme to cope with increasing demands over the winter. So ministers were warned. But Pillar 1 and Pillar 2 testing capacity did not increase significantly over the summer. In recent weeks, only half of all tests have been received in less than 24 hours. He's repeated his point about asymptomatic people asking for tests. Can he publish the Pillar 2 data, which breaks down how many are symptomatic and how many were asymptomatic in asking for those tests? Many parents report going to walk-in centres with their sick children when themselves had no symptoms and being given a test. Was that a national policy, and has that national policy been abandoned? We welcome the recognition that people need financial support to isolate. We've been saying that for months. But as I understand it, it's only available to those low-paid workers who are also on benefits and not all low-paid workers. So will he consider expanding the eligibility criteria? We've always said that when testing breaks down, tracing breaks down, and the virus gets out of control. And we are now facing a second wave of infection. We don't want, Mr. Speaker, a second wave of ministerial mistakes. All of us want to avoid a further national lockdown. Lockdowns or circuit breaks extract a heavy social and economic price, especially on the poorest and more vulnerable. But controlling the virus and protecting the economy are linked objectives, not in conflict with one another. So I understand he'll tell us we have to anticipate the Prime Minister's statement, but can he confirm that he will use a lockdown if we have one, that he'll use the time wisely, that he'll expand NHS lab capacity, that he'll put public health teams in the lead on contact tracing, that he'll quickly assess the university pilots on saliva testing, that he'll validate PCR pool testing so when those lockdown restrictions are lifted, we can contain the virus for the future. I welcome what he said about prioritising NHS staff, care workers and teachers today. But can he clarify why he has issued guidance to hospital trusts, placing restrictions on the numbers of tests they can carry out? And how will he protect care homes? According to reports today, many care homes have had to wait over 2 weeks for their test results. And data from Public Health England shows that over 200 care homes have had an outbreak of COVID in the last two weeks. And will he ensure that no one is discharged into care homes without a COVID test? Given where the virus is, what support will he, or what is his advice to the shielding community, and what protections is he putting in place for those from Black, Asian, and minority ethnic communities? Given that we know there's a disproportionate number from those communities in ICU today, none of us want to see another lockdown or circuit break, but we of course understand if one becomes necessary. But test, trace, and isolate should have been fixed. That failure has left us vulnerable and exposed. Now we must act with speed to save lives and minimise harm.
Thank you very much, Mr. Speaker, and I'm grateful to the honourable gentleman opposite for the constructive approach in which he's approaching these difficult times. He and I agree that the strategy to suppress the virus whilst protecting the economy and education is the right one. And I think that in so doing, it is important to act fast so as not to have to act bigger later. I also agree with him that no one in this House came into office to have to put in place restrictions like these. And he asked about the importance of people following the rules. The truth is, it is vital that all people follow the rules that we put in place. The vast majority have throughout, but critically, enough have not followed them that we need to make them mandatory in many cases rather than relying on people's civic duty. That is the fundamental judgment behind making self-isolation mandatory, as I have announced in the statement today. He asked about testing. Of course, we have that record testing capacity right now. A record 233,000 tests were done out of that capacity on Friday, and that lab capacity will continue to grow. He also asked about the NHS testing capacity, and that will continue to grow also. In fact, I had a meeting with Simon Stevens, the head of NHS England, on that earlier today. He asked about pool testing and using pool testing and saliva testing. These are just two of the many new testing capabilities that we're bringing to bear. And he also asked to ensure that there would be no admissions to social care, to care homes, without a test. That is our policy, not just no discharges from hospital, but no admission from anywhere into care homes without a test. And that was reiterated in the social care winter plan that we set out on Friday. But I suppose at the heart of the response of the official opposition and my response to him is that we are united in wanting to tackle this virus and in sending the message to everyone across this country that it is critical to follow the rules and for everybody to play their part in making sure that we can suppress this virus whilst protecting as much as possible the things that we love.
Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. I support the measures outlined by the Health Secretary, which are regretfully both necessary and proportionate. Last week on World Patient Safety Day, the WHO announced a charter for health worker protection, which asks all WHO member states to commit not just to adequate supplies of PPE and mental health support, but also to make sure there is zero tolerance of violence against health workers. Will he commit the government to sign up to this charter so that as we go into a second wave, all our brave frontline workers know that this government and this House stands foursquare behind them?
Yes, I will happily sign up to the proposals that my right honourable friend has set out. As the House well knows, my right honourable friend's long-standing and international work on patient safety is very, very impressive. And we must make sure that in these difficult times we protect our care workers and our frontline staff, including, if I may say so, the staff at the testing centres, and make sure that we reiterate once again our commitment to patient safety.
Coming back, SNP spokesperson, Dr. Philippa Whitford.
Thank you very much, Mr. Speaker. As the Chief Medical and Chief Scientific Officer said this morning, the UK is in danger of losing control, as we have seen in many countries in Europe. And as the Secretary of State has said, we could be facing 50,000 new cases a day by mid-October, which would lead to about 200 deaths a day by mid-November. And no one should be in any mistake to think that the virus has changed, and it will not kill people if we get back to where we were in April. I agree utterly with the Secretary of State that we need to take action now, and that action is personal. Every single person has responsibility to stick to the rules, to wear a face covering, to wash their hands, and to keep their distance. And I would remind members in this House, because I've been watching it from outside, that that is not always what is on show in this chamber. And we all have a responsibility to set an example. And that responsibility extends to self-isolating, whether we have symptoms, whether we are proven, whether we are a contact, or whether we have returned from a high-risk country. If we are meant to be isolating, we need to do it. And I really welcome that the government is finally putting in place this financial support for people on low incomes who might be tempted not to isolate because they simply don't have any other opportunities to feed their family. However, it is critical that we have a fast and responsive test and trace system. And therefore, I have a couple of questions for the Secretary of State. In recent weeks, he has talked about aiming to have 500,000 tests a day by the end of October. So with the surge we are facing, does he envisage being able to accelerate that and bring it forward? And secondly, on the 8th and 15th of September, he committed to me that he would be increasing funding to expand NHS testing. But as we heard from the Shadow Secretary, NHS trusts in England have been told that funding is capped and they are not to expand COVID testing. Surely this is resource that we want to use and make available.
Thank you very much, Mr. Speaker. Well, I wholeheartedly agree with the Honourable Lady's comments about the need for action across the UK. And we've seen in Scotland, as in England and Wales and Northern Ireland, that the number of cases sadly has risen sharply. And I welcome her physically back to the chamber in demonstrating this unity of purpose across the four nations of the UK. If we can bring forward the goal of 500,000 tests per day from the end of October, then of course we will, and we're pushing that as hard as we can. We are on track to meet that commitment. As she says, that is across the UK, so that does include the tests that are done by the Scottish NHS, and I know that there have been conversations between the NHS in Scotland and in England to work on making that happen. And as for NHS testing, yes, we are expanding that, including the funding, and in the funding letter that went out to the NHS for the second half of the financial year, so the covering winter, that includes the commitment to support financially the testing that's done in the NHS in England.
We now come to Chris Cradley.
Mr. Speaker, and can I welcome the measures my right honourable friends announced today. He seems to be getting the balance absolutely right, and I praise him for the job he's doing. But we do have to remember, Mr. Speaker, that there are huge regional variations in the impact of the virus at the moment. Many parts of the country have much lower infection rates. Given the huge consequences of this virus for people in our communities on their mental health, particularly the younger generation who are paying a very heavy price, can I say to him that given those regional variations and in the full knowledge of all the pressures that he is facing, I do not believe the case for further national measures has yet been made.
Well, thank you very much, Mr. Speaker. There is an important balance between the measures that we need to take across the country as a whole and then the further and stronger measures in local areas. And my right honourable friend will have seen over the past, especially over the past week, that we have expanded some of those local interventions to cover bigger geographies. But he's absolutely right that there are some parts of the country where the number of cases is still thankfully very low. And so the balance between what we do nationally and what we do locally is as important as the balance in terms of what we do overall.
Lera Wilson.
Mr. Speaker, I'm sure the Secretary of State will agree with me that one of the greatest tragedies of the first wave was the loss of life and the impact on our social care sector of this dreadful virus. And we must learn the lessons from that as we head into a second wave. So whilst he has emphasised a prioritisation of testing in care homes, both in the media and his statement today, could he explain why a number of care homes are still reporting a 2-week delay in receiving test results? And will he clarify whether his prioritisation also includes staff providing care in people's residential homes?
The care home testing is incredibly important. We have brought down some of those response times, and I'm glad to report to the House that since last week when we debated and discussed the very sharp rise in demand, including amongst asymptomatic people, that demand has come down somewhat and the pressures are a little lower. That doesn't, on the testing system as a whole, that doesn't mean that we don't want to increase capacity further. Of course we do. It is very important that we have tests available for all vulnerable people, whether they live at home or in a care home.
We now come to Chair of the Select Committee on Science, Greg Clark.
Thank you very much indeed, Mr. Speaker. Perhaps I could ask the Secretary of State that the scientific evidence is that COVID is detectable by test within 7 days of someone being infected. So why shouldn't people who've been made to self-isolate be tested 7 days after a possible infection and be released if they test negative?
The incubation period before which the virus can present itself is still estimated to require a 14-day self-isolation. If we can bring that figure down, I'd be the first to be pleased to do so. And as we took to 10 days, the period in which somebody who's tested positive must self-isolate, and this is a point that is critical on which we must rely on the scientific evidence. If he has further scientific evidence, I'd be very happy to look at it.
Very Caliphon.
Thank you, Mr. Speaker. Can I ask the Secretary of State if he thinks a £10,000 fine will act as a disincentive to poorer people getting a test?
Well, we've put in place the extra £500, the £500 in addition to other income that people are getting for people on low incomes in order to support them to do that self-isolation. I think that people want to know whether they've got the virus, if they've got symptoms, and the result of having a positive test is that you get the money, the extra £500 if you're on low incomes, and of course you have to self-isolate. So I'm confident that people will come forward, of course, do the right thing for society, but also the right thing for them to find out what the cause of their illness is if they have symptoms.